Okay, so welcome to the channel. Today we are starting with the first topic of upper limb, that is breast. Before this, you just have to have idea about like the names of the muscles. Pectoris major, minor. Just take a look at them. No need to memorize them or anything. Before breast, there is a short topic called as clavipectoral fascia. It is short topic, but many times it comes as a like very short answer. This is why I'm taking it. So this is our clavipectoral fascia. This so like it lies posterior to the pectoralis major. It encloses our pectoralis minor muscle. It extends from clavicle to the like lower line of axilla. So now we read it in notes. Clavipectoral fascia is the strong facial sheet which lies deep to pectoralis major muscle. It extends from clavicle above to axillary fascia below. Attachments: it is attached medially to anterior intercostal membrane of upper to intercostal space. You guys will be confused, like if you won't be knowing this. Just remember, medially it gets attached to ribs, like anteriorly. Okay, and laterally it attaches to coronary process. This is not that important. Just have an idea. The above and below attachments are important. Above it splits and encloses the subclavius muscle, like we can see in the diagram. See subclavius muscle. Now after this, uh, it splits to enclose subclavius and attaches to lip of subclavian groove. See, this subclavian groove is present on the inferior surface of clavicle. When you guys will do osteology, like before your vivas and all, you will notice this. Then below the glycotrachea splits and encloses the pectoralis minor muscle, and then continues as suspensory ligament of axilla, which gets attached to dome of axillary fascia. This is in the diagram. See, clavicle, subclavius muscle, pectoralis minor, axillary fascia, suspensory ligament of axilla. And also there is an important thing in this. This is like quite commonly asked. Structures piercing clavicula fascia. So there are four: thoracoacromial artery, cephalic vein, lateral pectoral nerve, and lymph nodes. Lymph nodes are axillary group of lymph nodes. These are very important and will come in breast. You will notice it. You will see them later. So what are the four structures? Thoracoacromial artery, cephalic vein, lateral pectoral nerve, and axillary lymph nodes. This is the diagram. This is the diagram for structure piercing, and this is the diagram for clavipectoral fascia. Okay. So now we'll move on to our main topic, that is breast. So for breast, we will study it in 7 subpoints, out of which the blood supply and lymphatics applied and structure, these are very important. Like when if you get this of 15 marks, these subheadings will have more marks. That is it. So what is breast? Breast is an modified sweat gland. It is rudimentary in male and well developed in female. It is obvious. So now extend. So breast extends vertically from second to sixth rib in the mid clavicular line. So you guys must be knowing what are like clavicular lines. So if this is clavicle, this is mid clavicular line, and if this is axilla, this is mid axillary line. You guys must have studied this in general anatomy. And then horizontally it extends from lateral border of sternum to mid axillary line, like this. Lateral border of sternum to mid axillary line. Vertically from second rib to sixth rib. Okay, that's it. This is the diagram. So for long question, you have to draw at least 5 to 6 diagram to score maximum marks. Okay. So now structure. Now in structure, the breast consists of like 3 components: skin, parenchyma, and fiber fatty tissue or stroma. Okay. Now skin. Skin consists of two things: nipple and areola. So what is nipple? This is general knowledge, but I'll explain it a bit. Nipple. It is a dark conical projection in the center of breast, pierced by 10 to 15 lactiferous duct, and it also contains smooth muscle fibers. Next is areola. Areola is a circular blackish discoloration around the nipple. It contains numerous modified sebaceous gland, which secretes oily secretion and lubricates and prevent nipple from drying and cracking. You guys would have noticed this, like there is a condition called as cracking of nipple, where the nipple gets hard. It usually seen in winter. it is like a bit painful. So like various creams are available in the market. Next is parenchyma. It is an glandular. It is a glandular part made up of alveoli, lactiferous duct, and lactiferous sinuses. This is the diagram. Here we can see this is the breast, this is the nipple, and the area around it will be areola. Now we are seeing this is the parenchyma. Also, there is a thing called as what do you see? Just wait a second. Within which skin, uh, nipple, areola, parenchyma. Parenchyma is like the what do you say? This whole connective tissue. Then you have fibrofatty stroma. It consists of fibrofatty tissue. Like fat is distributed between ligaments, which are called as ligament of Cooper. This name is important. This ligament of Cooper divides the gland into 10 to 15 lobes. So now that is we are done with the structure of breast. Now we have relations. So for relation, it is easy only. The superficial relations are skin, superficial fascia. Then deep relation are which are present behind the breast. These are like what do you say? Pectoral fascia or the fascia covering pectoralis major. There are three muscles prominently: pectoralis major, serratus anterior, and external oblique. External oblique is a muscle of abdominal region. You guys will get this when you study abdomen. Then we have loose aerial tissue of retromemory space. This retromemory space has a specific function. It provides the movement, like the movement is seen when a person walks. No, it is because of this retromemory space present between breast and pectoral fascia. If you guys want to see this, wait a second. Uh, this space is called as retromemory space. Now now blood supply. So the blood supply is prominently by what do you say, four things. This is our what do you say, this is our axillary artery, which gives out branches such as thoracoacromial artery, lateral thoracic artery, and artery which goes down, that is internal thoracic artery. And this internal thoracic artery gives out perforating branches. This is the diagram. These are the labelings, and it is also written down. The breast is an highly vascular organ supplied by following arteries: internal thoracic artery, which gives out perforating branches, second, third, and fourth. This is internal thoracic artery is also called as internal mammary artery. And then we have lateral thoracic artery, superior thoracic artery, and acromiothoracic artery. These are all branches of axillary artery, like this. This is axillary artery, and all these three are the branches of axillary artery: lateral thoracic, superior thoracic, and acromiothoracic. You guys will study this in next topic. Then we have lateral branches of posterior intercostal arteries. These intercostal arteries we will study in the thorax region, in the thorax chapter. So next we have lymphatic drainage. This lymphatic drainage is very important. Okay, so the lymph is drained by what do you say, a set of lymph nodes. Like also this is quite important because the infection can travel like what do you say, I will get to that later. First see the lymph nodes. You have to just draw the diagram and remember the names. So as we have parasternal lymph nodes, these contact bidirectionally. Then we have posterior intercostal lymph node. Then we have central, like a group of axillary lymph node. It consists of four things: central, lateral, anterior, and posterior. You guys like draw this diagram 2-3 times. You will get the hang of it. Then we have deltopectoral lymph node. Then we have apical group of axillary lymph node. I guess that is it. There is also a thing called as subpectoral lymph node, through which the what do you say, tumor of breast can reach ovary, and this condition is called as Krukenberg syndrome. Not much important, just because included here. I told you. Then we have applied anatomy, that is carcinoma of breast. So mainly it is a carcinoma of breast is quite important when the applied anatomy is asked. So carcinoma of breast is called as breast cancer. Then this is the point I told, that the cancer cells may infiltrate the suspensory ligament, because of which breast becomes fixed and immobile. Therefore, when you are checking for the cancer in females, you usually palpate the breast and you feel a bit stiffness or like hard substance, it is like big indicator for further diagnosis. Then what do you say? The cancer cells can also go to vertebrae, then to brain via the venous route, because of connection between the veins draining the breast and the vertebral venous plexus. Because after this breast go to go to spinal cord, then it reaches our brain. This is a special condition called as PUD orange. In breast cancer, the skin over the breast has an orange appeal. Like if this is orange, there will be a like spot. This is called as PUD orange. This is caused by the obstruction of cutaneous lymphatics, leading to this appearance. I guess that is it for the breast. We'll meet you in next chapter. Okay, thank you.